Question 1. A nurse is administering warfarin. Which laboratory value is most important to check before administration? A. Platelet count. B. Hemoglobin level. C. INR value. D. Creatinine level. Answer: C. INR value. Question 2. A patient prescribed phenytoin reports gum, bleeding, and swelling. What should the nurse do? A. Reassure the patient it's normal. B. Document and monitor. C. Instruct increased fluid intake. D. Notify the healthcare provider. Answer: D. Notify the healthcare provider. Question 3. What is the safest action when a medication dose on the MAR is illegible? A. Ask another nurse to interpret it. B. Administer the most common dose. C. Contact the prescriber for clarification. D. Skip the dose until the next shift. Answer: C. Contact the prescriber for clarification. Question 4. Which of the following medications requires monitoring for ototoxicity? A. Furosemide. B. Lisinopril. C. Acetaminophen. D. Lorazepam. Answer: A. Furosemide. Question 5. A nurse notices that a medication was signed off but not administered. What is the appropriate action? A. Ignore it unless the patient complains. B. Administer a double dose. C. Document the error and notify the provider. D. Ask another nurse to give the dose. Answer: C. Document the error and notify the provider. Question 6. What should the nurse do before giving a patient their morning medications? A. Confirm the patient's allergies. B. Ask the physician for verbal consent. C. Skip the check if the patient is stable. D. Give medications and chart later. Answer: A. Confirm the patient's allergies. Question 7. A nurse is preparing a high-alert medication. Which practice is essential? A. Asking the patient if the dose is correct. B. Having another nurse independently verify the dose. C. Estimating based on weight. D. Relying on memory for preparation. Answer: B. Having another nurse independently verify the dose. Question 8. A patient questions a new medication. What should the nurse do? A. Tell them to trust the provider. B. Delay and consult the pharmacist or provider. C. Insist on giving the dose. D. Ask another nurse to explain. Answer: B. Delay and consult the pharmacist or provider. Question 9. A nurse is asked to administer an unfamiliar medication. What is the most appropriate response? A. Administer it to avoid delay. B. Look it up in a drug reference. C. Ask a colleague to give it. D. Refuse to administer any new medications. Answer: B. Look it up in a drug reference. Question 10. Which action best promotes patient safety when administering multiple medications? A. Preparing all doses at once. B. Labeling all medications clearly. C. Administering medications from memory. D. Delegating administration to a UAP. Answer: B. Labeling all medications clearly. Question 11. A nurse is preparing to give a transdermal patch. What must be done first? A. Apply the new patch over the old one. B. Place patch directly over a wound. C. Remove old patch and clean the area. D. Fold the patch in half and discard in trash. Answer: C. Remove old patch and clean the area. Question 12. Which task is appropriate to delegate to a UAP in medication safety? A. Assisting patient to take PO medications. B. Documenting medication administration. C. Reminding patient to take scheduled meds. D. Injecting insulin to a diabetic patient. Answer: C. Reminding patient to take scheduled meds. Question 13. The nurse finds a patient with new onset confusion after a medication change. What is the priority action? A. Reassess in 1 hour. B. Notify the healthcare provider immediately. C. Discontinue all medications. D. Administer naloxone. Answer. B. Notify the healthcare provider immediately. Question 14. A nurse is giving an intramuscular injection. What must be verified to avoid harm? A. Size of the syringe. B. Patient's muscle tone. C. Correct medication and route. D. Length of the needle. Answer. C. Correct medication and route. Question 15. A client states, "That pill looks different from what I usually take." What should the nurse do? A. Tell the client medications often change appearance. B. Check the medication label and order again. C. Administer the dose and monitor. D. Ask another nurse to verify it. Answer. B. Check the medication label and order again. Question 16. A nurse is giving medications to a patient with dysphagia. What is a safe approach? A. Crush all medications and mix with pudding. B. Ask pharmacy for liquid forms if available. C. Insert tablets into feeding tube. D. Skip medication administration. Answer. B. Ask pharmacy for liquid forms if available. Question 17. A nurse is administering for vancomycin. Which assessment is most critical? A. Heart sounds. B. Blood glucose. C. Renal function. D. Bowel sounds. Answer. C. Renal function. Question 18. What is the best response if a patient refuses a medication? A. Insist the patient take it. B. Document refusal and reason. Notify provider. C. Discard the medication and document. D. Give it later without informing the patient. Answer. B. Document refusal and reason. Notify provider. Question 19. A nurse is preparing an oral liquid medication. What is the safest method to measure the dose? A. Use a teaspoon. B. Use a marked medication cup. C. Estimate with an oral syringe. D. Use a paper medicine wrapper. Answer. B. Use a marked medication cup. Question 20. A nurse finds expired medications in the medication cart. What should be done? A. Administer if it's only slightly past the date. B. Ignore and report later. C. Remove and report per protocol. D. Ask the patient if they're comfortable taking it. Answer. C. Remove and report per protocol. Question 21. A patient receiving for morphine begins to experience shallow respirations. What is the nurse's priority action? A. Call the rapid response team. B. Elevate the head of the bed. C. Administer naloxone per protocol. D. Stop the for infusion. Answer. C. Administer naloxone per protocol. Question 22. What action ensures safe administration of a medication requiring renal dosing? A. Monitor urine color. B. Assess creatinine clearance. C. Measure hemoglobin levels. D. Check blood pressure. Answer. B. Assess creatinine clearance. Question 23. A nurse is administering chemotherapy. Which PPE is most appropriate to wear? A. Sterile gloves and gown. B. Mask and shoe covers. C. Chemotherapy-rated gloves and gown. D. N95 mask and sterile gloves. Answer. C. Chemotherapy-rated gloves and gown. Question 24. What should the nurse do before administering digoxin to an infant? A. Check apical heart rate for 1 full minute. B. Measure radial pulse for 30 seconds. C. Assess respiratory rate. D. Offer oral fluids. Answer. A. Check apical heart rate for 1 full minute. Question 25. A patient is prescribed a new antibiotic. What should the nurse ask first? A. Have you had any recent weight changes? B. Do you have any medication allergies? C. Are you feeling nauseated? D. Can you afford this medication? Answer. B. Do you have any medication allergies? Question 26. Which action is safest when administering a subcutaneous heparin injection? A. Aspirate before injecting. B. Massage the site post-injection. C. Use the abdomen and rotate sites. D. Use the dorsogluteal muscle. Answer. C. Use the abdomen and rotate sites. Question 27. A patient with a PEG tube is prescribed a crush tablet. What is the priority nursing action? A. Administer with carbonated water. B. Check if the medication can be crushed. C. Flush the tube after the full medication pass. D. Mix with milk for easier digestion. Answer. B. Check if the medication can be crushed. Question 28. Which medication route has the fastest onset of action? A. Oral. B. Intramuscular. C. Subcutaneous. D. Intravenous. Answer. D. Intravenous. Question 29. A patient on warfarin presents with blood in the urine. What is the nurse's best action? A. Continue warfarin as prescribed. B. Document and reassess in an hour. C. Notify the healthcare provider immediately. D. Offer extra fluids. Answer. C. Notify the healthcare provider immediately. Question 30. A nurse administers a medication to the wrong patient. What is the next step? A. Document the error and assess the patient. B. Tell the charge nurse later. C. Wait to see if the patient reacts. D. Apologize and move on. Answer. A. Document the error and assess the patient. Question 31. A nurse is administering insulin lispro. What timing is essential? A. 60 minutes before meals. B. With the last bite of the meal. C. Immediately before eating. D. 2 hours after eating. Answer. C. Immediately before eating. Question 32. A nurse notes a provider wrote an order for 10 of insulin. What is the safe action? A. Administer as ordered. B. Clarify the dose with the provider. C. Convert the dose to ml. D. Write over the order. Answer. B. Clarify the dose with the provider. Question 33. What is the priority when administering medications to a patient with dysphagia? A. Give all pills at once. B. Use thickened liquids. C. Crush sustained-release tablets. D. Mix with juice. Answer. B. Use thickened liquids. Question 34. The provider prescribes an unfamiliar form medication. What should the nurse do? A. Look up the medication before administration. B. Ask a colleague how to give it. C. Call pharmacy after administering. D. Assume it's routine and give it. Answer. A. Look up the medication before administration. Question 35. Which statement indicates correct understanding of medication reconciliation? A. It's done only at discharge. B. It prevents medication errors during transitions. C. It only applies to controlled substances. D. It's the pharmacist's responsibility alone. Answer. B. It prevents medication errors during transitions. Question 36. A nurse is preparing a heparin infusion. Which precaution is most important? A. Check potassium level. B. Verify with another RN. C. Administer by forepush. D. Mix with normal saline and dextrose. Answer. B. Verify with another RN. Question 37. Which medication requires close monitoring of serum trough levels? A. Amoxicillin. B. Vancomycin. C. Acetaminophen. D. Prednisone. Answer: B. Vancomycin. Question 38. A nurse prepares a scheduled dose of hydromorphone. What action promotes safe handling? A. Sign out the drug after administration. B. Have another nurse witness waste. C. Store it in the patient's drawer. D. Discard unused portion without documentation. Answer: B. Have another nurse witness waste. Question 39. A nurse observes a coworker documenting a medication before giving it. What is the appropriate action? A. Ignore to avoid conflict. B. Report the behavior per facility protocol. C. Document on their behalf. D. Tell the manager during shift report. Answer: B. Report the behavior per facility protocol. Question 40. Which action ensures safety when administering a topical medication? A. Apply using bare hands. B. Rub vigorously for absorption. C. Use gloves and label the site. D. Mix with lotion before applying. Answer: C. Use gloves and label the site. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.